Hi, my name is Emily Lieberman, and I am a graduate student at the University of New England. Today, I am going to be presenting to you a community needs assessment for the Township of Asbury Park, New Jersey. So, with this presentation, we are going to look into the background information on Asbury Park. Then we will go into the community of interest, talking a little bit more why I chose to focus on Asbury Park in particular, and which individuals in Asbury Park I want to speak upon. I'm going to showcase the key findings of barriers that exist in the community from speaking with key informants. I'm going to propose a plan of action to help with the community and to face any barriers that might exist. And finally, I'm going to end the presentation by talking a little bit about risks and challenges that are associated with this plan of action. So let's start off by talking a little bit about the background on Asbury Park. So Asbury Park is located in Monmouth County, New Jersey. I grew up just about 15 minutes from Asbury Park. So for me personally, Asbury Park is a town that I really enjoy coming to. It's a very big beach town in the summer. There's a lot of restaurants, there's a lot of attractions, there's bars on the strip, so a lot of young people in the summer. So Asbury Park is a very lively and fun atmosphere to be in. But some more information that is presented by the United States Census Bureau on the actual town of Asbury Park. So the population is roughly about 15,188 individuals, with a total household number of 7,477. The median household income being about $63,461. And then the amount of individuals that are over the age of 65 is 1,922, which we will discuss further why I included this statistic. The population without health insurance is roughly 13.2%, and individuals who are disabled in Asbury Park is 18.5%. So we could see the population of Asbury Park is about 15,000 people, but within those 15,000 people, we have a lot of different variables to consider. We have stuff like health we have to consider. We have to consider the disability and those over the age of 65 when looking at the barriers that can affect nutrition for this population. So, looking into the community of interest, I decided to look into individuals over the age of 65 living in Asbury Park currently. So, you may be asking, why did you choose to look into individuals over the age of 65 compared to individuals of different age demographics? So, when looking into research, I found that older adults are most common to be diagnosed with malnutrition due to chronic disease developments that include diseases like cancer, diabetes, Alzheimer's disease, and other conditions that can have an effect on their appetite, how their metabolism runs, and how they are able to eat foods. Other diseases like dementia as well. Older populations might forget how to eat their food or might not be able to eat their food on their own. So that internally creates malnutrition, and that affects the overall health and the nutrition status of this age demographic. The second thing I found is that older adults that are experiencing food insecurity showcase negative mental and physical health conditions that include depression and lower cognitive health function. Along with depression and the lower cognitive health function, this can also affect how somebody is able to eat food. Most people, when they are suffering through a mental illness, they don't want to eat anything, along with a physical health condition that might make it hard to even pick up food or be able to cook for themselves, get their food. That all plays into a factor of how food insecurity is prevalent in this demographic. Finally, I found that those over the age of 65 are at most risk of developing nutritional deficiencies due to factors that include poor nutrient and dietary intake in the form of daily food consumption, limited financial resources, and taking medications that do not allow for the body to properly absorb nutrients. So, of course, if you're not eating enough nutrients in a day, if you're not getting your nutrients from food consumption, if you have poor dietary intake, that's going to lead to deficiencies in things that include iron, zinc, vitamin A, vitamin C, etc. So I think these three bullet points really show why the specific population of those over the age of 65 living in Asbury Park is most important when considering the population that I want to focus on and what barriers might exist for that population in general. So, when looking through my key findings from 10 key informant interviews for this community needs assessment, I decided to look into key informants that would be able to give me the most information. Some examples of the key informants that I was able to talk to include key informants from the VNA, from the WIC, from nonprofit organizations that exist currently in Asbury Park, individuals that work within food banks. I've talked to other healthcare professionals such as doctors, EMT workers. I also decided to talk to residents of Asbury Park who may, not have the background in healthcare, but firsthand are able to explain what it feels like to be a resident in Asbury Park, what they witness within other residents in the area. So I thought within the 10 key informants, I had a good mix of individuals with different backgrounds that were able to give me the most information about the community of Asbury Park. So the key informants were asked several questions regarding barriers that exist within Asbury Park, what they think the biggest challenge for those over the age of 65 are within Asbury Park, what improvements the city and the community can see. So basically, the findings show that services provided to those in the community, the services that currently exist through the key informants that I have interviewed that are part of different organizations or work at nonprofits. There are organizations that work with housing. We have organizations that work with providing food. There's transportation, health and nutrition screenings. There's organizations that provide referrals and financial aid as well. So we can see that within the services provided, the most services that are currently provided within Asbury Park are mostly referrals from these informants. There's not a lot of services in regards to transportation. And the other services like housing, food, health and nutrition screenings are kind of like the median of the services that are provided through these informants in general. So, when asking about the major barriers that currently exist within Asbury Park, the top barriers that were found with transportation, 5 of the informants reported this is the major barrier, the lack of public transportation. Income, that was the majority vote of the major barrier that currently exists within Asbury Park with regards to the economy, not making enough money, being cut off from working, etc. One key informant informed that the homeless population is the major barrier that a lot of the individuals that she sees in her office, a lot of it has to do with the homelessness. And then the last one is other factors that include COVID-19 or language that have created a lot of barriers within this community. So overall, I would say the top two barriers that I found through my key informant interviews was the lack of public transportation and the income status is what creates a lot of barriers for this age demographic in Asbury Park, New Jersey. So, plan of action based on the key informant interviews by doing past research on the needs of the demographic over the age of 65. The first one that I consider to look into is focusing on improving public transportation within the city of Asbury Park. Creating bus stops would be more beneficial than having just one train station within the town. That can be hard to walk to depending on your location. Also, creating free shuttles for the population of Asbury Park over the age of 65 to get to one point of town to the other. Just thinking of different ways that would be easier for those looking to travel outside of their homes and not just getting home delivery meals or having people come to their house, them themselves being able to get out of the house, get to grocery stores, get to doctor's appointments. That I think is definitely super important to consider with the public transportation improvement. And then the second point of action that I decided to look into is creating free fundraising events with current organizations within Asbury Park to help promote their services to the community. So some of these organizations that currently exist, I also was able to speak to key informants from these Organizations include Meals on Wheels of Monmouth County, Empower Me, the Jersey Shore Rescue Mission, the VNA Health Group, and the Mercy Center all either provide food, shelters, services, clothes, referrals, etc. Working with these organizations by providing registered dietitians that can provide free nutrition screenings, that can provide cooking classes for healthier meals, being able to provide foods that those older populations can easily access and can easily cook with on their own time. Just being able to work with these organizations by either showing up to their businesses once every week to see their patients or see the people that are coming to get free food or free services. I think being able to work with these organizations to promote more of that healthy nutrition for this population will also really help with the barriers and will help see improvements with lowering the risk of developing malnutrition for this population and lowering the risk of any nutrient deficiencies for this population as well. And being able to promote just overall healthy eating for the older population is definitely something that is super beneficial with this plan of action. So finally, with any plan of action, there's always going to be barriers and challenges that arise. The top 3 challenges that I think would occur with this specific plan of action include timing, just figuring out how quick and how we're able to, come up with this public transportation act, how we're able to create these fundraising events, how long it's going to take, how much time in the day it is going to take for the volunteers and for the dietitians to promote their services. Those are all factors that have to be considered with these type of plan of actions. Of course, cost is another super important one. How are we going to get the funding? Will we need grants? Will we need donations from those in the community? So those are other factors, as well as how are we going to pay employees? Is it going to be strictly volunteers? So I think cost is definitely something that would have to be considered. And lastly, the aid for those with disabilities and mobility issues can become quite challenging. That can also affect the cost and the timing of this plan of action. So, seeing how we're able to help those that aren't able to move around, those with mental or physical disabilities, being able to overcome those challenges is something that I believe can be done, but it's definitely something that is still going to be a barrier and a challenge with this plan of action. But I believe with a good team, a good mindset, having strategies and a plan, that these 3 barriers are something that can be overcome, and the town of Asbury Park and those residents over the age of 65 will be able to ultimately see better results with their nutrition through my plan of action. And these are the references that I used for this presentation. I want to thank you again for your time and consideration with my community needs assessment, and I hope you enjoyed my presentation today. Thank you.